Tommy's parents arrive and are brought in to see him as he's prepped for surgery. He tells them he was upset since they weren't there. They do their best to reassure him and stay with him as he is brought to the operating room. Tommy's surgery is lengthy, and his parents feel more anxious as they wait. They worry about whether his injuries will be permanent and the length of recovery he will need. They wonder what to tell their other children and how this will affect them. A social worker meets with Tommy's parents in the waiting room.
Okay, so the day of this, Tommy, he was playing in the park.
Mm-hmm.
What if Tommy dies?
So, you have other children?
What if Tommy is paralyzed? Will he be all right?
Okay, so you have to break this down to the kids.
Will he be the same as before?
Yeah. Okay, well,
What am I going to tell our other kids? Who's going to care for them?
And how old are they? 7 and 9. Okay, I know you're very worried and have a lot of questions. I don't have much information except that Tommy is coming out of surgery and into recovery, which is a very good step. I do know that the doctor will be in shortly to meet with you about Tommy's accident. Mm-hmm. Okay? There's a phone on the wall. You can dial 9 to get an outside line and make any calls. Okay. Is there anyone you want me to call?
No, we're okay. I'm just worried about my kids at home.
Okay.
Hi, I'm Dr. Banerjee. We met earlier. Tommy's in recovery now, and he'll be transferred to the PICU. We repaired his liver and his femur. We were most concerned about his liver. And
Did something go wrong?
When do we get to see him?
Healthcare professionals are experts at providing medical information. In times of distress, some parents or caregivers may not be able to focus on this information because their worries and feelings overwhelm them. In addition, many parents have questions that they're hesitant to ask for fear that they will seem foolish or will break down emotionally in front of others. But until their worries and questions are addressed, caregivers may not be able to focus on important information or make good decisions regarding care. When meeting with parents, it is helpful to take an emotional read on the situation and reflect back what the parent may be feeling. For example, saying, "I can see that you're upset," or "I know everything seems overwhelming right now," acknowledges a parent's state of mind and helps them feel understood. Studies show that healthcare providers are sometimes reluctant to ask about parents' emotional reactions for fear that they will escalate their distress. However, these studies show that the opposite is true. Asking caregivers about their distress often decreases it, as well as conveys openness and empathy. One note of caution, however, while parental distress is common in a crisis situation, studies suggest it is not helpful to dismiss or explain away their distress as normal. This often has the effect of invalidating their distress and blocking further communication between the doctor and the parent. In this situation, Tommy's surgeon would have been more effective in communicating with the parents if she said,
Hi, I'm Dr. Banerjee. We met earlier. I could see that you're really worried about Tommy, and I just wanted to let you know that everything went okay. He'll be in recovery shortly, and you'll get to see him soon. The prognosis looks hopeful, and I'm sure you're worried right now. What questions do you have? And what's worrying you the most?
Like this provider, address parents' or caregivers' worries by first asking about their primary concerns. Then provide emotional reassurance before moving forward with the clinical information. Also, remember that you will need to speak slowly and take regular pauses to allow them to absorb the information. It's helpful to check in with the parent, especially if they have not said anything. Asking open-ended questions like, "What thoughts do you have about this?" or "What questions do you have right now?" is preferable to yes or no questions like, "Do you understand?" since they will help you determine if the child or parent has understood the information in the way you intended.
Tommy's internal injuries require strict bed rest and constant observation. He is in critical condition for the first 2 days. Tommy's parents are comforted by the constant monitoring he receives, but they are still anxious and have not slept much. They also feel overwhelmed by the sights and sounds of the ICU, seeing other children hooked up to equipment, seeing upset parents, and hearing codes. It is difficult for them to sort through all of the medical information, but they feel awkward about asking more questions of the medical team. Friends and relatives call to check on Tommy. They are grateful for the support, but have a hard time explaining the situation over and over again, especially when his condition seems somewhat uncertain. They do not want others to worry too much. The entire family feels the strain of the trauma. Tommy's sister calls frequently to check on him. At one point she asks, "Is Tommy going to die?" Her mother hesitates before saying, "I don't think so."
For many families, the full impact of the trauma begins to be felt after the initial crisis subsides. While traumatic stress can develop at the time of illness or injury, studies show it also occurs throughout treatment, especially when ongoing uncertainty maintains a sense of life threat. The hospital environment can be traumatizing to children and families. Sights, sounds, and smells can be especially distressing. Parents of hospitalized children report that seeing their child in pain or hooked up to medical equipment is particularly traumatic. They often experience intense feelings of helplessness and distressing thoughts about being inadequate to comfort or protect their child. Even when parents feel more confident and in control, they can get overwhelmed when sorting through medical information or making decisions. They may also worry about their finances, job obligations, and other stressors at work or home. The stress also ripples through families and those in their supportive networks. Parents are often uncertain regarding what to say to family and friends. Should they allow siblings to visit? Should they protect others from an uncertain prognosis and just try to stay positive for everyone's sake? Initially, healthcare providers can lessen families' distress by helping them adjust to the hospital and to the adversity of serious illness or injury. Take a fresh look at the hospital environment through the eyes of families and orient them regarding normal sights and sounds and what to expect. Many families are resilient and have coping strengths that simply need to be identified and gently mobilized. Ask parents about their needs and help them enlist support from family and friends. Providers can also give examples of how other families in their situation have coped. Help them decide what to say to others so they don't feel so unprepared. Most importantly, encourage them to take breaks and to care for themselves, acknowledging that they may not want to. For additional suggestions, see the DEF pocket cards on the Healthcare Toolbox website.